Here are some tips on how to properly perform a pinwheel assessment. Hi everybody, my name is Dr. Perman. I'm a board-certified chiropractic neurologist and I focus primarily on rehabilitative techniques for concussions, migraines, and dizziness. For a pinwheel test, it's very important that we are directly on the skin. We have to make sure that we're on the skin so that the patient is actually feeling the sensation of the pinprick. If we're going through clothes, that will suppress the sharpness of the device, which can affect your test. So make sure that you are directly on the skin when you perform these assessments. Next, we have to make sure that when we're doing these assessments that the patient's eyes are closed the entire time. We have to remember patients are going to fake their way through your examination whenever they can. So we have to take as many variables out of the equation as we can. So by having the patient's eyes closed while you do the sensory examination, it makes it so that they can't pretend that they felt something that they didn't actually feel. And lastly, we have to remember that this is a comparison from side to side. So we're picking one dermatome to work on, and we are going to compare that dermatome on this side to that same dermatome on the other side. So we're looking for discrepancies in how much you feel the sensation from side to side, and then we're always going to note the side of diminished function. Now, that doesn't mean that the side of diminished function is the side of the problem. It is possible to have hypersensitivities to pain, which might be the actual issue, but to keep things standard, we, in our notes, are always going to note the side of diminished function, even if that diminished side is not the main issue. Now, in order to determine which side is the problem, if you do have a discrepancy, that is when you're going to test dermatomes against adjacent dermatomes. So if I feel like I have diminished sensation on the C6 dermatome on my right side, I'm then going to test the C5 dermatome on that right side versus the C7 dermatome on that right side to see if there's a difference between that C6 dermatome on that side and those other dermatomes. If they feel the same, it's likely that the other side is the problem. So when you have that discrepancy, one side feels it more or less than the other, make sure you then test the dermatomes around that dysfunctional dermatome on each side so you can really see where the imbalance actually is. Please be on the lookout for future videos where we will dig into how to specifically perform a pinwheel assessment on each specific dermatome. But if you have any questions about pinwheel testing in general, please leave a comment below or reach out and we're happy to chat with you further about it.